My name is Maria Maricela Maena, and these are my children. The clinic has helped me a lot, and I am very grateful because my son has had an infection of his skin, and one day I came to Tim's clinic. I didn't know about it before, and they opened the door to me, and I'm very grateful because they have helped me a lot with my children.
The importance of having doctors and nurses come from the United States to work with us creates an opportunity to share best practice. Our doctors can learn, but they can also share about illnesses that are uncommon in the United States, while also learning from American doctors their skills and expertise. This exchange of experience is very important so that we can work better and give high-quality care at Tim's clinic. The work here in the clinic is completely humanitarian. I have not worked here long, but I have really enjoyed it because we have been able to identify patients that are not getting the care they need. Yesterday we had a patient that had been seen on and off by a variety of different doctors, but no one was giving this child consistent follow-up, so his problem was not being controlled. Now that we have him in our system here at Tim's clinic, this child has gotten so much better, and it has improved his life so much. We also see many children with neurologic problems that need rehabilitation. We are managing these children's care and coordinating with specialists in the local hospital or in Managua, or if they need help through Los Popitos. These kids are no longer lost in the system. They now have a place where they can get follow-up care they need. It's not that these children don't get any care from the government, but it's just that no one is seeing them on a regular basis. Here we can do that. This makes me feel very happy.
Buenos días, mi nombre es Lilian Oviedo.
Good morning, my name is Lilian Oveda. I am the mother of Angelito, who is a special needs child, as you can see. He is 3 years old. We have been coming to Tim's clinic for the last year where they gave us very good care. The people here are very friendly and the doctors are extremely kind and they give excellent care. I am particularly grateful for the care that you have given to my son and especially for the donation of supplies that he needs. And I hope that you keep coming, especially for children like my child that needs so much.
The barrio in Alexis Arguello is right over here. It's a new barrio that Tim's Clinic is serving. 5 years ago, when there were some terrible mudslides throughout the country, people from all over the country relocated to this sort of empty farming area here in the foothills of Esteli and squatted on the land and took over. And there are about 3,000 people, including at least 800 to 900 children in the barrio that haven't had any services, no electricity, no water, and certainly no health care. And so Tim's Clinic has been dedicated to working with the Ministry of Health to establish health care for the children.
¿Podría firmar acá, por favor?
For what Tim's Clinic is able to accomplish currently, it costs about $4 to give each child preventive medicines to prevent parasites, malnutrition, etc. for 3 months. $4 per patient.
These are already made for
For years we've been doing surgeries that change children's lives. Because of all of our dedicated volunteer time, which is free, donations go directly to the cost of surgery, $140 per surgery, which is impossible in the United States. What would we like to do? We would like to start a community health worker model in the barrios, the slums that we serve. We want to hire and train 10 health workers to work with the community to bring kids to Tim's Clinic. And we want to have a nurse coordinator here at Tim's Clinic to work with Dr. Sosa. All of that would cost only $10,000 a year for a nurse and 10 health workers to coordinate all that care.
So this is our OB-GYN room, obstetrics and gynecology. Dr. Phil Fleming came with us several times and helped us to establish this. He actually came in contact with a hospital that was getting would give us this ultrasound machine. And it was perfectly functional. They just wanted to get something higher tech. And so we arranged to have the ultrasound machine shipped down here and brought up to the clinic. It was an incredible day when I was here and Dr. Fleming would examine pregnant moms and show them ultrasounds of their babies. They were totally fascinated. They'd never seen anything like that. And then he would print off a picture of the baby in utero. And so that was a great time. We do have gynecologists and obstetricians that come here to meet the needs of the women. They come once or twice a week. And so this room has been a great addition to Tim's clinic to take care of some of the needs that women have.
We'd also like to start our own laboratory here at Tim's clinic. Many of our patients can't afford to go to an outside lab, or to get the results of those labs for our doctors takes days. If we open our own lab, we can take better care of kids. It would cost $10,000 to start up and fully equip the lab, and only $600 a month to hire a dedicated lab worker and all the supplies, all the agents that we need to run the lab.
For the volunteers that come, it's a great opportunity for them to see the need that is here in the community. I would like to extend an invitation to anyone that would like to come and volunteer. It's not just about the work, but it's also about the love. It can be the most important thing you bring, having people that want to serve and give love to those who are most in need.
Nosotros amamos al consultorio TIM.